Can a family's socioeconomic status, SES, affect a child's brain development? SES includes three main components: income amount, education level, and occupational status. SES can impact overall total surface area of the brain's cortex and impact the development of specific areas in the brain as well. One specific area of the brain that SES can impact is the amygdala. As part of the limbic system, the amygdala is located in the medial temporal lobe of the brain. The term medial references its location to the midline of the brain. The midline is an imaginary line that would split the two hemispheres. The term temporal references which of the brain's four lobes it's located in. The temporal lobe is located on the side of the brain. Obi-Wan Kenobi might explain its location this way. If you held one lightsaber to your left eye and a second lightsaber to your left ear and turned them on simultaneously, the location where the two lightsabers crossed is roughly where the amygdala is located. Although the amygdala contributes to emotion, reward, motivation, learning, memory, and attention, it is most well recognized for being involved in the processing of emotions, particularly negative emotions like fear. The size of the amygdala is associated with various factors. For example, anxiety and depression have both been linked to differences in total amygdala volume. This video will discuss one study that looked at how the experience of SES is related to amygdala development in children and adolescents. One of the main findings was that lower family income and less parental education were both significantly associated with smaller amygdala volume in adolescents, children between 13 and 21 years of age, but not significantly associated with amygdala volume at younger ages, children between 3 to 12 years of age. The graph on the screen shows the relationship between amygdala volume, family income, and child's age. Low family income, graphed in red, was categorized as yearly earnings between $4,500 and $25,000. Middle family income, graphed in green, was categorized as yearly earnings between $35,000 and $75,000. And high family income, graphed in blue, was categorized as yearly earnings between $125,000 and $325,000. Total amygdala volume is on the y-axis, and children's age is on the x-axis. Both sides of the graph show a separation of the family income lines. If you look at the left side of the graph, which focuses on the youngest children in the study, the red line is the highest, suggesting that in early childhood, children from lower income families have the highest total amygdala volume. Now look toward the opposite side of the graph. If you look at the right side of the graph, which are the adolescents in the study, the red line is the lowest and the blue line is the highest. This suggests that in the adolescent years, children from higher income families have amygdalas with greater total volume compared to lower income families. If we focus on children from low income families, this graph tells a story about the unique trajectory of their amygdala growth. In early childhood, its volume is the largest, but by adolescence, lower family income was related to lower amygdala volume. But why is there this reversal pattern? This study categorized families making between $4,500 and $25,000 as low income. A child who is raised in a low-income family increases the risk of experiencing chronic stressors such as crowding, noise, dangerous neighborhoods, household chaos, and unpredictability, and lower parental responsiveness. These experiences could raise the amount of fear a child is exposed to, and since the amygdala is involved in fear processing, impact its growth trajectory. The authors reason that the larger volume in early childhood could be related to amygdala hyperactivity, since the amygdala is reacting to higher amounts of negative emotions such as fear and stress. Long term, high levels of negative emotions might lead to amygdala atrophy, or the smaller volume found during adolescence. It's like the amygdala is overworked during early childhood, processing high levels of stress that negatively impacts its total volume later in adolescence. The smaller amygdala volume for adolescents from low-income families is more than just an interesting neuroanatomical discovery. The study also found that adolescents with smaller amygdala volumes were more likely to have higher levels of depression. This seems to suggest that negative early life stressors may not only impact the size of one's amygdala, but also our later emotional life. This study demonstrates how experiences can impact brain development. The findings suggest that lower family income is related to larger amygdala volume in early childhood, but that prolonged levels of negative emotions and stress may result in a smaller total volume in adolescence. Furthermore, in adolescence, a smaller amygdala volume was related to higher levels of depressive symptoms.